You are welcome to this presentation, and the objective of this presentation is to share experiences, strategies for actually sustaining and advancing the care of the bleeding disorder in Lesotho, to promote the dialogue as well as the knowledge sharing to address issues between the World Federation of Hemophilia, the national member organizations in Hemophilia associations, and then the health professionals in large, as well as the national governments to deliver the better care for people with bleeding disorders. So this will be a 2-minute presentation that will showcase um, the impactfulness of the work that we've done, especially the involvement of the Ministry of Health in Lesotho, of which in non-communicable diseases, um, we're vested to improve in the policy adoption, um, and making sure that the health system is strengthened for improved diagnosis, for access to medicines and care, as well as collaborative mechanisms. So it's very wise for me to note that there is a policy in place that talks about bleeding disorders. It's also under the non-communicable diseases, which is also framework within the comprehensive national cancer control program that needs to be endorsed. Now, there is the MOU, Memorandum of Understanding, um, between the Haemophilia Association and then the Ministry of Health as well, and as well as the standard treatment guidelines are there in place, as well as the essential medical list to make sure that um, services are rendered well. There is a multi-sectoral collaboration which has been developed by the Ministry of Health as well, the Ministry of Education, and the Ministry of Social Development. Now, the MOU is there, it's signed, it's reviewed every 5 years, and the policies are in place. Um, there is a health system strengthening where the country made a very good advocacy and the awareness countrywide in all the hospitals, visiting all the hospitals countrywide, even the hard to reach ones in the mountains. And then there's collaboration with the World Federation of Hemophilia and Norfolk Hemophilia, South African Hemophilia Foundation, the Supply Chain National Drug Supply Organization in Lesotho, the Maseru Regional Hospital, where the HTC, the Hemophilia Treatment Center, was opened in 2023, as well as ECCD schools, Ministry of Health, of Education. We have been very active. With this short presentation, we really say Lesotho has improved because we have also twinned with Mauritius, South Africa, and then the successes are that of the HTC, which is in place. It will be extended to other districts, other hospitals. Staff were trained. It's equipped with staff. It's also equipped with well-trained doctors and nurses, and the laboratory is trained. The step-down trainings were carried out, and the laboratory equipment it's within the budget of the national budget of the Ministry of Health. The advocacy committees established, as well as the caregiver training which have been conducted. So, treatment milestones, we have got 18 non-patients which are on prophylaxis. Two of them, they've got factor 8 inhibitors, and then they are also receiving emicizumab prophylaxis, those with factor 8 inhibitors. And then we also picked the long lost patients from our outreach programs. And then we've got the new diagnosis. Now we've picked one with Van Wilbur's disease, and then the other one with the factor Hemophilia B. So with this presentation, I was just only highlighting the milestones that we went, and this summarizes the synopsis of all my advocacy and my business development as the world ambassador of World Federation of Hemophilia, and also assisting Lesotho and then the neighboring countries. Thank you for listening to me. Thank you very much.